to WeDriveHealth Podcast. I am JT here with Dr. Nate.
Yep. Dr. Nate here, CEO and founder of WeDriveHealth. And I'm grateful for us to actually have this platform to share some very good insights, some pearls. We're pretty excited about all the amazing things that we want to share with our listeners.
Yes, we are.
Yeah.
So, why are we doing this podcast, Dr. Nate?
You know, I am tired of asking or answering the same questions over and over. I get the same patients. I truly enjoy my patients, so I'm always kidding. But we are so much more alike than we think, right? It doesn't matter what the patient looks like when they sit in my chair. We ask the same maybe 5 to 10 questions or have the same 5 to 10 complaints. And I realized, you know what, it would probably be beneficial if these are the patients that I have that are asking the same questions. Can we speak to a broader population of people who are also ruminating with thoughts of what they want to ask their primary care provider, but they're scared to. So this is going to be the uninhibited versions of what do you want to talk to your primary care provider about. We'll talk about stories, scenarios, all of these types of different types of elements that makes up a patient. Because patients, they're all holistic. We are holistic beings. Mm-hmm. So I feel like sometimes in the primary care world, we forget that we're not just attacking the physical ailment. We're actually talking about mental, emotional well-being. So we're holistic beings. We should have a holistic discussion.
Nice. So let's talk about how we met.
Yeah.
So those who don't know Dr. Nate, he does not answer his phone ever. Mm-mm. Not he'll look at it and he just be like, nope, not today.
Right.
So how do we meet? And it's actually funny because we actually met in this space here.
This exact space exactly a year ago, maybe?
Almost a year ago. So shout out to LeVaro.
Yeah, shout out to LeVaro. So I was asked to be a moderator for a health discussion for men's health. And I had some colleagues who were going to be the guest panelists, and they asked me to come on and moderate. And it was a crazy rainy night. I remember the weather was insane. I was driving from the boondocks of one part of Long Island to get it to here in Queens. And I end up showing up, and the guest panelists ended up not showing up. Mm-hmm. I'm not going to name any names, but y'all owe me some things. Y'all owe me some things. But so at this point, you know, we were kind of figuring out how to pivot from that, right? What are we going to do? We had this curated discussion that was supposed to be set to happen. And JT, this extraordinary guy here who's like planned the event, said, hey, why don't we just kind of...
Planned is use that word loosely.
Right.
You know, I just show up.
You just show up and you just last minute surprise and you just get things done somehow, some way. Yeah. So JT with his JT magic just rearranged some chairs and say, hey, let's turn this into a circle and let's just have a discussion. It ended up being one of the most impactful nights of my life. I don't think JT knows how important that night was, but I think that it was very important to see us men having very, very vulnerable conversations. Mm-hmm. We were transparent with each other. I gave a little bit of a glimpse of what it's like in the health world, so I was answering some health medical related questions related to men, but overall there was a lot more discussion about emotional, mental well-being, and it's just been amazing since then.
So I do kind of want to, and we'll kind of go back to that story a little bit, but I do want to point out that I don't even think like the guys, it might have been like 20 guys that day, I don't think that they were able to kind of ever have a conversation, an intimate conversation with a healthcare provider with how you were able to, you know, just shoot out information because once they started, it didn't stop.
It didn't stop, yeah.
It didn't stop, and I think that even for you, that you didn't realize how impactful it was for them. Like that they had somebody, and you know, you're a young guy, right?
Right.
Relatively,
relatively young. Yeah.
Relatively young guy.
On most days, I feel young. Yeah.
So for them, it was like, yo, I'm actually able to speak to this person, and he actually understands what I'm going through. So I think that was super beneficial.
Yeah.
And go ahead.
Yeah, no, I was just gonna say relatability is very important in any aspect, right? We gravitate towards celebrities that we can pseudo relate to. We gravitate towards athletes that we can relate to, whether they look like us, when they come from the same hood as us. Whatever it is, there's a relatability that makes us more likely to thrive and really better ourselves because the impact is greater. when that happens, when you could relate to whoever you're dealing with. So I think that's always very important.
Right. Even when like the closer that we got, I was like, oh, he's a cool guy.
Yeah, he
Like,
thought I was a dork when he first met me. So, here we are now.
And then one day I turned around and he had the do-rag on. I
Yeah,
said,
I was like, yo, Thug Life. Thug Life. Shout out to Flatbush. Shout out to
wait,
Flatbush.
where you from, bro?
I have some street
He
cred
was like-
now. I got some street cred in your eye. So, yo, this guy, he's too mad. This cat is too much.
I had the do-rag on, still had the line. I was like,
the
bro,
crease was still
what's
there.
going on?
Yeah, that was that early morning crease. I loved it. But
So
yeah.
it was. I thought that was funny that after a certain time, like I realized, okay, even though he's a doctor and whatever the case may be, like he's just a regular guy that had regular needs and stuff like that.
Yeah.
So it was amazing. And it's funny because I always think about that, especially like I guess this is the year that we've known each other. Like it's almost like you were definitely placed in my life at that time, right?
Right.
And so I'm clear on that. And so I kind of want to move into like my experience with you as a provider, right? So I basically only had like 3 doctors my whole life, right? Like I was a pediatrician. I went to a pediatrician, and I had already graduated from nursing school.
Right.
And I was still going to my pediatrician at like 20, married,
Yeah,
everything
yeah,
still.
yeah.
I was like, what's going on here? I was like, what's going on here? They were like, yeah, you probably should check some other provider. So I ended up going to my boy, shout out to Dr. Nicolo. So I ended up going there for a little while. And it was good, like it was a great experience. But then read into you, and I was like, you know what, I want to support you, whatever the case may be. So I ended up coming to you. And literally, you asked questions that nobody's ever asked me before. And I was like, man, like this is good. And remember during that time, like my BP was all elevated.
Yeah.
And he was like, he really stopped me like, dude, like, what are you dealing with? So talk about that and how like you approach your patients.
I appreciate hearing that perspective, because the first thing I decided to do when I went into primary care from the hospital, right? The hospital setting, you only have 5 to 15 minutes with your patients. You stabilize them, you move on, right? And so that's what I was used to. And then I realized after one chance encounter with a young patient in the ICU and his whole family, I realized there's a lot more to just putting a Band-Aid on something, right? There's a lot. We're very complex beings, and I think that the questions that we ask need to be a little bit more complex.
Right.
We need to start addressing a little bit more who we truly are, instead of just saying, hey, okay, tell me, here's your blood pressure, here's a blood pressure medication. So I envision myself in all of my patients. What would I want my provider to ask me if I was given that opportunity that would make me feel like I'm heard, I'm seen, I'm understood in the healthcare sphere, right? And I feel like, especially when you're a minority, you really don't feel like you're seen. So I think that's why when we say disadvantage, we really are saying that you're not seen as a typical, person of color who's navigating through the healthcare sphere. So it's really just me taking some time to realize I got to ask the right questions. I only have a certain amount of time to engage my patients, but I want to make a quality, personalized time. Curating something that's personalized treatment plan for a patient, that makes a world of a difference,
No, definitely. Even for me personally, like when you started asking certain questions, like, so tell me about work, and I'm like, dude, I'm stressed out.
Yeah.
Like he was like, you might want to look into, and basically he was like, you kind of went through like each aspect, like body, mind, and all this stuff, and I was like, do you? I don't want to say do you really care, because I know you care,
Of course.
right? But at some point, like, is it like when? Because I'm assuming that other patients start pouring.
Oh yeah.
Their heart and soul into you.
yeah.
So how do you navigate with that, right? Almost keeping it still professional, but caring, and so like.
You know what I realize? We all have problems, right? So when a patient sits in my chair and they say, yep, everything is good, doc. Yep, no headaches, no blurry vision, no dizziness, no chest pain, no shortness of breath. I'm going to find something. I'm leaving here with something, because I believe that there's no way that we're just perfect beings living in a perfect life.
Right.
And just, again, the reminder is that we are impacted by our environment, by our genetics. There's just so much. We're so complex that there's a lot more that I think it just requires a lot more thinking outside the box when I'm engaging with patients. So, so I think that's really a great thing that I hope to continue. And really, what I'm learning now is that patients, while they're coming in because they need their annual physicals, or they're coming in for like a little episodic visit, like, oh, I have a headache, so I'm coming in for a headache complaint. We really are looking for health optimization. I think that when I speak to all patients, we want to live life to the best in terms of quality of life, right? We want to live long, we want to live healthy, we want to optimize our health, but we don't know how to really engage and do that, right? Like, we understand, oh, we got to exercise. Okay, what does it realistically look like for me as a father of 3 to support a family? I have to wake up very early. What does exercise really look like? I have to curate that into my schedule. So how do we get creative with telling people, listen, this is how you optimize your health. If you want to live long for your family's family, you want to create a legacy, you want to be the best version of yourself. So it's really that I really like, that's the focus. That should be the primary focus of every visit.
Okay, no, that's a great approach. And I know for me, right, like after having that conversation, I had to really look at like, okay, health, like, you know, you always hear health is wealth, yada, yada, yada,
Right,
yada.
right.
But I guess I only looked at it from the physical side and not really the mental aspect of it. So can you go into more into details with just how mental impacts the body?
Yeah. I mean, listen, you get depression. You get depressed. So what do? You sleep in more than you should. You tend to eat unhealthier snacks, right? So you tend to maybe binge watch a couple of seasons of something. You know, Game of Thrones is excluded because Game of Thrones, everyone should be binge watching.
Top tier.
But otherwise, when you're finding yourself in this very low space, or in this low frequency, as people would say, blood pressure starts to increase. Your midsection starts to increase. It's harder for you to lose weight. And I'm not judging you, because you feel attacked.
I feel
attacked. But yeah, these are things that people don't realize. All of your behaviors are compounded, or a sequelae, or just kind of a result of being depressed, right? When you're anxious about things, your heart rate starts to race. Your blood pressure goes up with that. When you drink more caffeine because you need to stay up late at night, right? So, and then you could go into irregular heartbeat later on in life. So these are a lot of behaviors that we've developed over time because we live in a very high stress environment in terms of our culture lately. And I think that that's what people don't recognize has physical impacts, right? Like, so all of these behaviors, we got to start recognizing, we got to be intentional about our behaviors first, understand that we're doing it, and then realizing the impact that it has. And then the final step is, how do I change it, right? That's practical for me. Because again, when you watch all of these podcasts and Instagram like reels, they're showing these athletes just working out. Yeah, 4 a.m, I got to work out. I do a cold plunge. I do all of these amazing things. That's great, but is it practical for everybody, right? So really just thinking outside the box of how we do that.
Yeah, you know? I mean, when you told me, like, and I mean, for me, I was already doing walks, so it was super beneficial for me already. But when you told me, like, do you meditate for a quick 5 minutes? I was like, you know how hard it is for me to, you wake up in the morning and you just go.
Right.
You like, do you take any time for yourself other than the walks? And I was like, no.
Yeah. But at the same time, I want to shout you out for the walks, because you have been very instrumental in giving us a glimpse of what walks do for you. And you're going to explain it for us, because I want people to understand the value and the impact a walk can have, because that's the simplest thing that pretty much all of us can do.
Anybody can do, right?
You know, so tell me what happens in terms of what transformational things tend to occur during your walk.
So at first, it was just, it was a way for me to listen to audiobooks. So I started out listening to audiobooks, because at that time I wasn't driving in my car. It was pandemic. So
Right.
Like I had to get outside. That was really kind of how. So I listened to my audiobooks, get outside the house, and it just became a thing. Like no matter what the weather was, I was like, "Yo, this is great." And then it started. I felt some level of healing, at least for me, right? So it was get a chance to really see nature. And I started watching like the squirrels. During the season. Like right now, as I'm walking, these cats you can see them squirreling away. Right. They fighting for terror. I'm just like, this is great. And every season, it's so funny talking about it now, but I really pay attention to what the squirrels are doing. These dudes are no joke. But it just started appreciating little things, right? And it started giving me like little gratitude. So I think for me, it was more so just no matter what the weather is, hail, sleet, snow, it didn't matter.
Yeah.
I was like, I kind of made a commitment to myself to be outside during that time, and it's been super impactful. And I think there was something that you said to me though. You were like, well, why don't you just walk a little faster? Because for me, it was more of a stroll. Like even though you were like, well, do it so that you can. How did you say?
Like increase your heart rate.
Increase my heart rate. You're uncomfortable having a conversation.
Yeah.
And I was like, okay. So I started doing that, and I felt the difference, right? Like so now, you start to feel your heart. And so now it's more, but it was just more so for me, just giving me a chance to think. Right?
Yeah. So that mental clarity.
My mind is constantly going, and so it kind of helped slow it down. What I've been doing as of late, shout out to my homegirl Kadeen. So like, I would call it like we used to speak whatever, and she'd be watching the Golden Girls. Like, yo, like what we doing? She's like, I don't have to think about it. It's like the same jokes. So recently I've been watching Frasier.
Yeah. The dry humor.
And it's great because then it calms me down. And I'm laughing.
Right.
I kind of know some of it, but I haven't seen it in years. But it's just something just to brighten up my spirit, so that when I fall asleep, I'm not thinking about the same thing. So it's kind of that thing that's been happening. So it's perfect for me.
That's similar to when I was telling you about how I changed my reading or the topics of what I'm reading, right?
Yes.
So I was reading a lot of motivational books, and they're all great. You get those moments where you need some to feel like Superman, like
stay hard.
Yeah, stay hard. What makes a great great? You're like And then there are other moments where you're just like, yo, I actually need an escape, right? Where I don't feel this pressure because the book told me, yo, you got to be great. All right, I got to be great. So here I am reading fiction books, like fiction novels, and I'm just sitting there, and it's a great escape. It does something very similar to what you're describing with the walks and the scenery, because now there's a mental scenery just happening in my mind while I'm reading a book. And I'm escaping the actual mundaneness of the medical world and, dealing with the business. So I think that's really something. Shout out to Jeremiah. Jeremiah put me onto that. He's big on like, hey, you got to be imaginative and you got to keep reading. You got to keep growing. You got to.
What was the name of the book?
So I read this book, Mouth to Mouth. Pause. No Diddy, but Mouth to Mouth, and
you edit that
part. Sorry. That came too fluid.
So wait, hold on.
Yeah.
So let's go back.
That.
So hold on. So what's the name of the book?
So the book's called Mouth to Mouth.
Okay.
And pretty much what the story was about is this gentleman who saves this guy's life, right? So he's drowning. He finds this guy drowning. He goes into the water, pulls him out. He does chest compressions, mouth to mouth. The person makes it. The person has no idea. The survivor.
Well, don't give us the whole story.
No, I'll just tell you this part.
Okay.
So this is the best part. So the survivor, the survivor gets whisked away, right, by the ambulance, and the person who actually performed the mouth to mouth, the chest compressions, the whole CPR joint, is like, yo, that was such a dramatic 10 minutes of my life, and then everything is over, right? There's no acknowledgement. It just happened. People kind of asked, are you okay? And then everyone, the oncomers were just looking away, and that was it. So then the whole series of events happens in the book that it's kind of cool to see the perspectives of both worlds, of what happens after you survive something traumatic and after you've provided something to sustain someone. So, yeah, shout out to fiction books, fiction novels. They're really out there.
So that's your new routine that you're going to incorporate?
Every 10 to 15 minutes in the morning. So I realize that, and I think we're all guilty of this, right? We pull our phones out as soon as the alarm clock comes on, and we probably scroll on Instagram, Facebook, whatever the social media vice of choice is. And I'm like, instead of doing that, I'm actually going to put a separate timer, and I'm going to give myself 15 minutes and just read this book. And that usually gives me like at least one chapter, right? And at that point, my mind already is at ease, and I'm not really feeling the pressures of, hey, the world is crumbling because life is happening.
Right. So I know once we spoke, you definitely want to focus on men's health.
Yeah.
Right? So why? What's the reason? Well, I know the reason, but explain to viewers why.
Let me tell you something. Ladies are so on point. They could have, I don't know, a twinking, little twinge in their little fingernail, and they come into the primary care office, right? They're really on top of their health, and shout out to women for doing that. But men, we really we pacify everything, right? Like until it's too late. The funny joke is that, When men's junk stops working, that's when they like to come to the office. So, it's 50% of the time, if a guy's coming to the office, it's either because their wives have dragged them to the office because it's been many years since the annual physical, or the guy realized his sexual performance is starting to diminish. And he's like, yo, what's going on, right? This is our identity. So that's the other half of the population that comes in. Regardless of why, men really are, because we're not used to seeing men coming into the office, we just have a standardized way of treating all patients, right? Which are dictated by women, because most women are coming into the office more than men. And I realize that men, we have unique needs, and we have unique set of problems, and that requires unique set of solutions, right? Like, how do I attack this in a different mindset than as a woman, right? Men tend to not want to take medications, which makes complete sense, right? We are holistic beings. There's many things our bodies should be doing to heal ourselves. But also, men have really bad habits because we're supporting families. We're doing a lot more.
More stress. And
more stress, exactly. So there's a lot of those things that it's really behavioral changes and behavioral discussions that need to be had. And I really, really enjoy like having those one-to-one discussions with men. Very transparent, vulnerable conversations.
So when men come in, are they like open like immediately, or you have to like?
Nah. So definitely not open immediately. Okay. Usually, what gets men? I don't know if you want me to drop the secret of what gets my male clients to open up. Should I drop the secret? All right. Yeah. It's usually when I ask something about social support. Right? So I could go through the whole physical. Yeah, I'm good. They'll maybe mention their junk, right? All right. If it's not working, doc, it's a little slow when I'm trying to perform. But every guy reacts the same when I ask the question of, if you're arrested at 2 a.m. and you could not call your wife or your significant other, can you name 3 people that you can actually count on to come to your rescue? And that's what usually stumps men. They start to realize, yo, I don't have that social support that I used to have. So it's the village.
Got it.
Yeah,
okay.
Or lack thereof.
Yeah. Because, a lot of guys are lone wolves.
Yeah, but I like speaking of lone wolves and creating tribes, you should probably tell us, how did you come up with Confidential Circle, right? Because this is something that we kind of have been doing in the office, and you've brought this into the office, and it's a great practice that we've had.
Well, thank you for allowing Krowned Kings to actually come into your space. So for me, I think, and kind of going what you were talking about, right? There's really not a space where men can just talk and just be and feel safe, really. And like, people hear the word vulnerable and they think the word weak, but for me, it's actually a superpower that I learned many years ago. So I thought it was important, especially with a lot of men that are that are dealing with whatever they're dealing with there. It would be a perfect marriage, if you will. Yeah. Where you're working on the physical side, whatever, and I'm trying to work on the mental side. Just having men just become better communicators. So for me, it was a match made in heaven, and so. Again, I want to thank you for allowing Krowned Kings to be there. Yeah. But I think it's necessary for men. Even like being in this space here with Lavaro, it allowed us to use his space here in Long Island City. So I appreciate that. Yeah.
So what is to be said about men having a tribe? Like, is this a necessity? Do you realize that we're lacking in it? What's your experience in that regard?
I see what you're doing. I see what you're doing, man. No, it's super necessary. Right. I think it's very, very necessary. And no man is an island, right? And like we talked about stress earlier and whatever the case may be, most of the time, everybody's dealing with similar variations of the same. Right. Money, relationship, family, kids. Everybody's kind of dealing with the same thing. And I think having a space where we can. And just for the ladies out there, it's not a space where we're bashing. I would say probably 10% of the time women come up and it's just
it's respectful. It's usually in a respectful space.
Yeah. And we definitely don't. We're not fans of the bashing of women, whatever the case may be. So it's a space where if you're having an issue with your significant other, then we'll bring it to the table. But we're not here to bash or whatever the case may be. So. But I think it's necessary as men to have people you can count on.
Absolutely.
You can trust. So I think every man should have, whether it's one friend or two friends, should have like a small wolf pack that you can grow together. Right? That you guys can have a vision of where your guys' lives want to go, and work together and keep each other accountable.
That's exactly.
I think the biggest thing with the confidential circle is more so accountability.
Right.
It's like if you say you want something that you want to work on and you want to improve on, all right. We're gonna, next time you come to the movie, we're gonna hold you to it. Like, hey, what's going on?
Of course.
And I think that's like the biggest, even just me and you, like, and just the relationship that we built, where it's like, all right, if I tell him, I know he's gonna ask about it. Like, a couple of days later. So what's the situation with that? And, obviously there are times I don't want to answer. I'm like, yeah, mind your business.
Right.
But then you follow up with me, and now it forces me to really address it.
Correct.
So I appreciate that for that.
Yeah, I mean, we don't grow in isolation, right? We need a community. Community is how we grow. So it bears reminding when we have these types of curated safe spaces, like you were mentioning before, that it's really for the benefit of us growing, right? So again, I'm grateful for all of the impactful work you've done so far. I can tell you our patients we've had some patients really on the verge of the edge, right? Where our hands are tied. We've tried therapy where they've done individual therapy. We've tried everything else. And they would come to these spaces and they would leave transformed, right? So we do appreciate that. And then we also instituted yoga in the space, which has also been a game changer, right?
Sheesh,
like
just for you and I.
Even
though we love to hate it.
We love to hate it. We love to hate it. It is a great way to have this mindfulness meditation, right? But we're also doing something physical, right? We're doing it in a community. All of us are we're pretty much all beginners, right? So there's no competition. It's just a relaxed atmosphere just to move our bodies, to really move our minds, to reset our minds. So shout out to Lisa from I Am Yogi Studios because she's done extraordinary work with us. So we continue to cook. What else have you noticed that we've been doing in the office?
So, but before we go to that, in terms of the office, like just talk quickly about the Men's Health Summit. Like, we can't leave that off the table.
we just had a nice little baby brew with this Men's Health Summit. It was a huge success. The reason why we decided to do it was, again, we've noticed that men probably had topics that really wanted to be talked about, testosterone being the main thing, right? So we decided let's curate a space where we can have this Men's Health Summit on a Sunday. We had 55 men show up, great turnout. We had vendors, we had food, we had DJs, we had experts that were all there. Shout out to all of our guest panelists. And I can tell you that the men were raving about it.
Dude, the takeaway was, I'm not even gonna hold you. It was mind blowing.
Yeah. You got to check out our Instagram page because we're posting up different testimonials after. But I'm telling you, these cats were like, yo, I'm hungry for more. We were planning to do it just once a year. Now we're considering it once a quarter. I don't know. It's a lot of planning in place, but it may be for the greater good of our community. So I shout out to all the men out there who take their health seriously, and they answered the call, answered the charge, said, you know what, I feel like I need to be in this event. So shout out to that.
Yeah, and to answer your other question, I think you have acupuncturists, right?
Yeah, we have acupuncture,
so
bro.
You have an official dude.
Yeah. How did you feel when you got your acupuncture treatment?
So that was the first time that I actually got acupuncture, and I wasn't looking forward to it. But you was like, just try it.
Right.
I was like, all right, let me just try it, and it was pretty good.
Yeah.
I ruptured my Achilles 3 years ago, so he really kind of focused on that area. So it was pretty good. What else you guys have at the office?
Yeah, we have medical massage. So medical massage is a little bit different than your standard massage, which your standard massage is like spa-like. This is a combination of both, right? So you have some ailments, true ailments, and these medical massage therapists, they know the anatomy very well. So they know how to reset certain parts of the body. You pair that up with like a pain management treatment, like trigger point injections, and patients are walking out of there. They were limping coming in, and they're walking out of there like, yo, I'm ready to run a marathon. Join us crazy.
So, and also you have stretch therapy.
Stretch therapy is amazing. Shout out to John Jay. He's been holding us down. This is myofascial stretch. So these are really for our patients who are pretty athletic, or at least they want to get a more athletic lifestyle or more active lifestyle, I should say. So he's really able to do some tremendous work with those patients, really resetting their myofascial cores. So shout out to John Jay. Extraordinary work.
Yeah, he's a good guy.
He's a good guy. He's a good guy. Yeah, he's a good guy.
Good guy.
Yeah.
So as we close, you just want to say just any final thoughts?
No final thoughts except that health optimization is what we're aiming for.
Hold on. So any final thoughts?
Yes. I want to just tell folks out there that the new age of medicine and primary care and all of that is about health optimization. It's about lifestyle. How do I maintain and how do I optimize my lifestyle? And that's really what we're trying to focus on. So we're pretty excited about all of the different things that we're going to kind of continue to talk about in our upcoming episodes. But I thank everyone for this platform. I thank everyone for this time. I think this is going to be extraordinary as we continue to grow. And do you have any final parting words?
No, live long and prosper.
There you go. Take care, guys.